You've been told you have a hernia, and surgery is likely next. Here's what that actually involves. A hernia happens when tissue pushes through a weak spot in the muscle wall, most often in the groin or belly area. Common types include inguinal in the groin, umbilical near the belly button, incisional at old scars, and hiatal at the diaphragm. Hernias don't heal on their own. No medication or exercise can close the muscle gap. Surgery is the definitive fix. Doctors typically recommend repair for pain, a growing bulge, or when the hernia limits daily activities like walking or lifting. Most surgeons choose between three approaches: open surgery, laparoscopic keyhole surgery, or robotic-assisted repair through small incisions. The surgeon returns the bulging tissue back inside and reinforces the weak muscle with a thin sheet of surgical mesh. Most hernia operations take between 30 minutes and 2 hours. Many keyhole groin repairs are same-day discharge procedures. In the first days, walking is encouraged. Desk work usually resumes within 1 to 2 weeks, with tightness that gradually settles. Most patients return to full activity, including exercise, around 4 to 6 weeks with their surgeon's clearance. Risks are uncommon but include infection, seroma, chronic pain, and hernia recurrence, which mesh repair helps reduce. Smoking, obesity, chronic cough, and heavy lifting too soon raise the chance of a hernia coming back after repair. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.